Good morning. Pleasure to be here. Beautiful New York City, beautiful day. Let me introduce the people who are here. From my far right, Kevin Bruin is the first Deputy Superintendent of the New York State Police. To my immediate right, Melissa DeRosa, Secretary to the Governor. To my left, Dr. Howard Zucker, Health Commissioner for the State of New York. To his left, Colonel Trapoto from the New York State Police. Thank you for being here. I hope everybody had their coffee this morning, because it is time to wake up America. The White House has been in denial on coronavirus from the get-go, and the federal response has just been wrong. That's not a political statement. If you look at the facts, that's exactly what it says. You have coronavirus increasing in 32 states across the nation. The rate of increase is only getting worse. And a number of excuses have been made for this over the past weeks to further the denial. First, they said, well, it's because they're doing more testing, and that's why the number of infections are going up. Not true, because the number of hospitalizations are also going up. People don't go into a hospital unless they're sick. That is a fact. Or because they think they're sick. So it's not a question of the numbers going up in the testing, it's the number of hospitalizations that are going up. So you know that the virus is increasing. And this has been getting worse, it's not getting better. And you look at where the United States is now, globally, Europe, that got hit first before us, we didn't know it, but the virus went from China to Europe, came to New York from Europe. That's why we had that big spike. But America now trails Europe in the recovery from coronavirus. The White House has been saying, reopen fast because that's good for the economy. And we have to get the economy going. Yes, we have to get the economy going, but reopening fast was not good for the economy. What has been happening is, when that virus spikes, the market goes down, not up. This was not a smart policy to rush reopening. It did not help the economy. It's the exact opposite. The volatility, the instability, the concern about the path of this nation has roiled the markets. And at the same time, from a public health point of view, the number of deaths is increasing. IHME, the model that the White House follows, just increased by 10,000 their death prediction, number of people who will die. Why? Because they're extrapolating out from the increase in infections and the increase in hospitalizations. The White House has been saying, well, it's up to the states, it's up to the states. But the president didn't really leave it up to the states. The president has been pressuring states to reopen quickly. Liberate your state, liberate New York, demonstrations that I've been dealing with all across the state, pressuring governors to reopen. The denial by the federal government of the severity of this virus was followed by the federal government's abandonment of responsibility. If you don't believe it's a problem, you don't try to find a solution. And that's what happened with the federal government and coronavirus. They never believed it was a problem, so they didn't believe they needed to solve it. The key barometer in all of this has been testing. Everybody said that from day one. Every federal official, every state official. Get the testing up. Get the testing ready. How many testing sites across America has the federal government set up and operated? 41. Well, is that a lot or a little? Well, For comparison, you know how many sites we have in the state of New York? 750. Federal government has put up 41 sites, FEMA and HHS, that they operate. How can that be? Because from day one, they told you they didn't believe it was a problem. They started day one, it's like the flu. If it's not a problem, you don't try to solve it. And they didn't try to solve it. And as a matter of fact, they have been advocating from day one, reopen the economy, reopen the economy. And now we see the results. It just plain hasn't worked, and it has been a failure. Will Rogers, when you find yourself in a hole, stop digging. Not a New York quote, but it's right. Where are we in New York? We've been smart. We didn't do this politically. We followed the facts. We followed the data, and it works. We have the lowest level of hospitalizations since this nightmare began, 853. Amen. We have the lowest 3-day average death total. We're down to 8 deaths yesterday. We remember the 8 in our thoughts and prayers, and we don't want to lose anyone in this state. But you look at where we are compared to where we have been. You remember at one time we had 800 deaths per day. Today we have 8. We do more testing than any state in the United States. We did 46,000 tests yesterday on a Sunday, and the infection rate was 0.8. When you're below 0.1, that's our goal. And 0.8 is lower than it was some points last week. You look at all the different regions, the numbers have been good all across the regions that are opening, going through phased reopenings. The numbers are all constant. You look at New York City. Within New York City, we study the boroughs because there's a wide variance in the infection rate. It tends to be worse in the outer boroughs, but you can follow that day by day, and that's good. We have a very elaborate tracing system so that when we find a positive case, we trace it back. That has been working very well because we have found traced back to clusters of cases. Westchester County graduation, where there was a young man who apparently came up from Florida and attended a graduation that generated 13 cases. There's an aluminum factory in Montgomery, 500 employees, 74 positives. Washington County, a slate quarry, 12 cases that we traced back. Oswego Apple Factory, 82 cases. This is actually good news. It means the system works. You find the positive, you trace it back, you find the common denominator, and that's how you stop the spread. You look at our curve compared to the rest of the country, you see the rest of the country is going up and we're going down. As we continue to test, we continue to trace, we have the data, we're continuing on our reopening plan. Phase 4 is ready for Western New York tomorrow, so we're excited about that. In New York City, we have complications that we are studying now. New York City is currently in phase 2. Phase 3 would begin on Monday. But there are issues that we have to think through. One is there's a lack of compliance with social distancing in New York City. You can see it in pictures. You can see it if you walk down the street. You can see the crowds in front of bars. You can see the crowds on street corners. It is undeniable. That is partially the responsibility of citizens not to do it. It's also the responsibility of the local governments to enforce compliance. We ask everyone to comply, but we ask the local governments to enforce the compliance. And I've said from the very outset of this to all the county executives, all the mayors across the state, look, the state is more than doing its part. the responsibility for the local governments, help with testing, help with tracing, but do the local compliance of the socially distanced and mask wearing. That is a complication in New York City. The other complication is the spread across the nation is also problematic for us. We are not a separate country, New York. Some people think we are, but we're really not. And we're not an island, right? People from the other states travel to New York, and New York is a hub. If other states have a high infection rate, probability is they're going to wind up increasing the spread and the infection in New York. We learned that the hard way. Why did New York have that big spike when we started? Why was New York so different from every other state? Because the virus came from Europe. When the federal government was telling us the virus was in China, it had left China, it went to Europe. We had 3 million people come in from flights from Europe, January, February, March. That's where the virus came from in New York. Likewise, we're bringing the rate down. Other states, it's going up. People get on planes in the other states, fly through New York, fly to New York. Probability is they're going to bring the infection. One of the issues we're working on in New York City, indoor dining has shown that it has been problematic, that a virus spreads in closed indoor areas that have air-conditioned systems. So we know that indoor dining has been problematic. Outdoor dining has worked very well all across the state, New York City included. The state's going to be reviewing the data and consulting with stakeholders in New York City. I started speaking with restaurant owners, business owners about the risk-reward on indoor dining. We've been speaking with Controller Scott Stringer, who raises a lot of good points about the risk of indoor dining. The Speaker Corey Johnson, the same thing. The mayor, the same thing. So I'm talking to business owners about it. We're going through the data, but this is a real issue. Our reopenings have worked very well. We're not going backwards, we're going forwards. A lot of these other states actually have had to go backwards. They started to reopen and they had to stop. But we want to study this issue primarily New York City on indoor dining. And we'll have a final decision by Wednesday, so people who operate those types of businesses will know what we're doing. But the increasing viral spread across the nation is also a problem, especially in New York City. New York City is where most of the flights come. New York City is where most of the travelers come. We have offered help to any state that is experiencing a spike. We have personnel who know this better than anyone in the United States. We learned it the hard way. We have equipment. We have testing capacity. So any state that needs help, we stand ready. I will never forget how good this country was to New York when we needed help. And the door swings both ways in life. Relationships work both ways. When I asked for help, we had 30,000 people from across the country, healthcare professionals, who volunteered to come to New York. At our peak, I mean, that was an amazing sign of generosity. So we don't forget as New Yorkers, and we'll be there for other people. A few additional announcements. The Video Music Awards are going to be held Sunday, August 30th at Barclays Center. There are air filtration devices, air filters, that can actually help with the COVID virus. And NASA has studied these. There are HEPA filters, which are high-efficiency particulate air filters, that can actually filter out the COVID virus. The COVID virus is 0.1 microns. There are HEPA filters that can filter out 0.01. So any malls that will open in New York, large malls, we will make it mandatory that they have air filtration systems that can filter out the COVID virus. For many of these systems, it depends on what filter you install, called the MERV rating of the filter. But they have different filters that filter out different size particles. And they have filters that can actually filter out and catch the COVID virus. For large mall reopenings, which we haven't done yet, but we're going to make this mandatory. I would recommend, the state recommends, for all businesses and offices, they explore the potential for their air conditioning, air filtration system, adding a filter that can filter out the COVID virus. We have been looking at this issue because you look around the country and you're seeing malls, you're seeing air conditioning systems, indoor spaces that have been problematic. And we think this offers promise. Also, I'm a Queens boy, and I want to remind New Yorkers that fireworks are dangerous and fireworks are illegal. Fireworks are illegal. Some nights in New York City, it sounds like the Wild West with all the fireworks going off. I've never heard it like this before. They're disturbing, they bother people, and they are dangerous. And children, people get hurt every year. It is illegal. You can't do it. It is illegal. And the police department needs to enforce the law. But the state police are going to start a fireworks enforcement detail. We're going to try to prevent the fireworks from coming into the state in the first place before they get distributed. And I want to thank the state police, and the first deputy is here and the colonel is here. The primary supplier for New York State is the state of Pennsylvania. Not the state itself, but fireworks companies within the state of Pennsylvania. And we're going to be focusing on that route for the transmission of the fireworks. We'll also be helping local governments deal with this issue, but I need the local governments in this state to take it seriously. I know there's a lot going on a lot of levels, but this is illegal and it's dangerous, so we have to stop it. And to the president, because if we're going to turn this around in this nation, it's going to take the White House. And to the president, I say today, if you want to help stop COVID-19, then they should start telling the people of this country the truth. And this truth starts with how large a problem this is and how real a threat COVID is. It's the leadership to stand up and tell the American people, look at the increase across the country, look at what's happening to this country vis-a-vis other countries, look how it's hurt the economy. It is a real threat. And to start simply, the president can do two things. First, sign an executive order directing everyone to wear a mask. How we're at this point as a nation, and we still haven't done the simple, easy, minimal step of saying you must wear a mask when you're in public. And the president doesn't have to pass a piece of legislation, doesn't have to call the Congress. Just sign an executive order saying wear a mask. We did it 2 months ago in this state. The other states are just starting to do it now. States that were recalcitrant, governors who said, we don't need to do this, masks don't work, all the political nonsense we heard. Now they're doing a 180, and you have the same states now wearing masks. Let the president have the same sense and do that as an executive order. And then let the president lead by example and let the president put a mask on it. Because we know it works. We've proven that it works in the state of New York. And the president can still be New York tough and New York smart and united and disciplined and loving. I want to show you one other thing that makes the point. For a second. This come down or does it go up? This, do we know what this is? This is the mountain. What is the tallest mountain in the state of New York? Mount Marcy. This is the mountain that New Yorkers climbed. You know, I keep showing the curve. This is the curve. It's actually proportionate. We started on day 1, and the numbers kept going straight up for 42 days. 42 days, New Yorkers dealt with that increase. Why did we have the spike? How did we get to day 1? Because the virus came from Europe and nobody told us it was coming from Europe because the federal government didn't know. We dealt with it. We paid the price. And we dealt with that spike and we climbed right up the mountain. We got smart. New Yorkers stepped up. We wore masks. We socially distanced. We closed down. And we stopped the curve. We plateaued. You look at the projections, they all projected that this spike would continue killing tens of thousands more people. New Yorkers came together and they turned the curve. And then we plateaued on day 42, and then we had to reduce the infection rate, and that decline went from day 42 to day 111. This was the trajectory of COVID in our state. We don't want to climb this mountain again. We don't want to climb this mountain again. And that's why the phased reopening, staying smart, staying disciplined, and that's why the spread across the country, that if that spread comes to New York, we could have to do this all over again. That's why we put in place quarantines. That's why we're offering help to all the other states. That's why we're saying the president has to step up, because doing this once in life is enough. We don't need to climb another mountain. One mountain was enough. We don't want to climb a mountain range. One mountain is enough. We don't want to do it again. Questions?
Governor, several more states might be added to the quarantine in the next few days. Has there been any concrete data on how many out-of-state visitors are already subject to quarantine, or how many have perhaps even been fined for your executive orders?
Let's just remember how the quarantine works. It does not name a state, any state. There's nothing to do with politics. There's nothing to do with I like Minnesota, I don't like California. It's an equation. It's a set of numbers. If your infection rate is above X, then when you come here, please quarantine, just because we don't want the infection to spread, and you don't want the infection to spread. I do not have numbers for you, Zach. We just put it in place, but as soon as we get numbers, I can get them to you.
Governor, the outbreak in Chappaqua, what's your level of concern about that outbreak? The school district there says they followed all the protocols and had them in place. The superintendent put out a message to the community saying, unfortunately, at the event and despite police presence, numerous individuals failed to follow our protocols. So what is the takeaway from this experience?
Look, you know, there are certain facts that are undeniable. A mask only works if you wear it. It only works if you wear it. Socially distancing only works if you do it. And then there are two ends of the equation. I've asked New Yorkers numerous times to comply, and by the way, the compliance rate has been fantastic. It has been fantastic. You look around Manhattan, you go to any city in this state, I will bet you it's 95% of the people are wearing masks. And just think how extraordinary that is. No state is doing what New York is doing. California just went to masks as mandatory mask wearing a couple of weeks ago, literally. I think it was even last week. We were doing this 2 months ago. And this is a different kind of behavior. It was never done before. I laid out the facts to New Yorkers, and they did it. God bless them. God bless them. And they've saved lives. But 95%, it's the 5% who don't do it because, for whatever reason, social distancing, except the 5% who don't do it. Local governments need to do the enforcement. They need to do the compliance. I talk to mayors all day long, and I make this point. Well, compliance is difficult. Why? Well, because people don't like to wear masks, and then we have to tell them to do it, and they don't want to do it. I understand. Enforcement of compliance is difficult. But it's the law. And look, I said, blame me. It's my law. I'm guilty. Let the police go up to someone and say, I'm sorry, you have to wear your mask. It's not the mayor. Governor Cuomo says you have to wear the mask. Blame me. But they have to enforce the compliance because it only takes one. All these clusters, it was one person. 1 to 13, 1 to 80, 1 to 70. New Rochelle, Chappaqua in Westchester. We learned this lesson in Westchester. It was one person in New Rochelle. We had the first hotspot in the United States. One person led to hundreds of cases. One person. So 95% is great. Yeah, but one person in that 5% can infect dozens. That's why the local governments have to be diligent on the enforcement.
Governor, if any dining were
Luis?
to not be allowed, is that something you're thinking about as being long-term, indefinite until there's a vaccine? Or would it be something maybe not allowed during phase 3, but maybe allowed during phase 4?
You know, Luis, it depends on the combination of factors. And again, nobody has been here before. So literally, this nation, this state, you're figuring it out as you go. My MO has been get all the information you can, study the other states, see what's happening, and then make a decision. It's not just indoor dining alone. It's indoor dining in New York City, where you already have issues with high congregations. You already have issues of people clearly violating social distancing. And you now have an added factor of viral spread all across the nation and a high likelihood that those people will come to New York City. It's that combination of facts that is precarious. And we don't have a decision. I want to take today, tomorrow, talk to everyone. We'll announce a decision on Wednesday. But all of these decisions are just for that period of time. You know, no one, anyone who says, well, what's it going to look like in 2 weeks? What's it going to look like in 3 weeks? I wouldn't believe any of those answers. You have to look at what is the viral spread across the country. What's the viral spread in New York City? We trace it every day. But it would be all of these are short-term measures.
And in terms of the New York City budget, the state budget allowed the state government to borrow billions of dollars because of the emergency. It allowed the MTA to borrow billions of dollars because of the emergency. What's the difference between allowing New York City and the MTA or the state government to borrow billions of dollars because of the emergency?
Well, you have a couple of issues. First, any municipality in the state that runs into financial trouble, who pays if a municipality gets into trouble? The cities are created by the state, right? They're created by state law. If a city or a county runs into financial trouble, the state steps in. New York City went virtually bankrupt in the 70s. The state had to step in. Yonkers, a city in Westchester, was virtually bankrupt. The state had to step in. Nassau County was virtually bankrupt. The state had to step in. Erie County, where Buffalo's in Erie County, was virtually bankrupt. The state had to step in. So whatever you allow the municipality to do, the state is ultimately going to be financially responsible. So you allow a locality to borrow. If that is imprudent, then it's going to be a state liability. So the state borrowing, it's our responsibility and we would pay. A city borrowing, it's a state responsibility ultimately if it goes bad. What all these localities have to figure out, and what we're trying to figure out is, I want to borrow X. Well, how do you pay it back? And when do you pay it back? And what do you think the revenues are going to be next year? And what do you think the revenues are going to be the year after? And how fast do you think business activity is going to increase? How fast do you think businesses are going to be back at full capacity and residents are going to be back at full capacity? So it's a very complicated economic equation. And then you have the big question of what is the federal government going to do and how much are they going to provide? Do you want to make a point?
Yeah, if I could just add, the debt that the state allowed ourselves to take out during the budget was short-term debt. So when the federal government moved the tax filing date from April to July, it deferred billions and billions of dollars for New York. And so we took this out as a way to get through to July, because as a result, we had to move the state tax date. So this was a short-term situation for New York State, and we've committed to paying it back by the end of the fiscal year. So this is not talking about long-term, so we're talking apples and oranges. And on the MTA wasn't given carte blanche to do borrowing. They were given the ability to issue debt. However, it has to be approved by the New York State Budget Director and by the MTA board, and they have not issued any debt to date. So there was a backstop, and there's fiscal watchdogs who are going to make sure that anything that they do, that it's being done fiscally responsibly. So they're not similar situations.
Governor, around day 42, you talked about why we were so dependent upon PPEs coming from Asia and China, and you charged the let's take care of it home. There's now concerns about prescription drugs also coming from Asia and from Europe. Have you had any conversations with any of your fellow governors along the Northeast region about seeing what we can do to address this problem?
Yeah, we have had conversations, but we didn't form a regional coalition yet on the drugs. You're right, it is an issue. We have done state purchasing. We have municipalities within the state where we do cooperative purchasing for the entire state. But you're right, it's a national problem. Where it's not just PPE, gowns, masks, et cetera. It's also the availability of pharmaceutical drugs, and it's something we're looking at.
Governor, more of the city economy is reopening every day. There are more and more workers who are worried that 24/7 subway service won't worse, some people stranded late at night. Would you guarantee that full 24/7 subway service will come back?
Yeah, we always said that when we were stopping the subway service for several hours in the middle of the night, right? When you say 24/7, it sounds like it's not a 7-day system. It operates 7 days. It's closed from like 1 a.m. to 5 a.m. Do you remember the hours? 1
Yeah,
a.m.
it's 1
to
a.m. to 5 a.m.
1 to 5. So, yeah, it's closed in the middle of the night so they can disinfect trains. And as soon as we get past this and you don't have to disinfect a train, then we'll be in a different place. Also, remember, you know, we're good at always seeing the downside, and there's been a lot of downside lately. If I said to a New Yorker, we've been arguing about cleaning the trains for decades, and the trains have been dirty for decades, right? Then it became a level of how dirty. If I told you that we were going to get to a point where we were going to disinfect the subway car. Now, to disinfect the subway car means every newspaper, every coffee cup, everything has to be out of that train. You can't have a napkin in that train. Homeless people have to be off the train. If I had told you that 10 months ago, you would have said impossible. It is impossible to do that in New York City. In my 62 years, I've never seen that, ever. And that's what we're now doing. Well, to disinfect trains, you have to close a couple of hours a night. Yeah.
But will they come back?
Yes. Yes. If you don't have to disinfect the train every night, then yes.
Governor, do you think that it's a possibility you would actually delay phase 3 for New York City? And you mentioned these complications being the enforcement in New York City of large gatherings. Are you saying Mayor de Blasio isn't doing enough? What should the NYPD and Mayor de Blasio be doing? There has been some controversy about how the NYPD was enforcing wearing a mask, not social distancing, et cetera. And then if you could also talk about the mountain behind you, how it was made.
I made it. I carved it myself. I'm a sculptor. Did you know? Yes, it's in the Italian. Yes, I am an artist. I've taken my artistic skills, where before I would just do drawings and some light painting. Now I've increased that to sculpting. I did it in my garage. It's made up of a blend of paper mache, cement, styrofoam, clay, and plaster. It's my own family recipe. My grandfather used to sculpt with it. None of that is true, by the way. But it is. Sounded good, didn't it? Tell the truth. I almost had you for a second. I had you with that Italian sculpting thing. It's made out of styrofoam. But it is proportionate to the increase and the decline. That is proportionate. And I wanted to show, look, first of all, I wanted to show New Yorkers what we did, what they did, what they did. I did nothing. I wanted them to see what they did and remember what we went through and remember why we don't want to go back there again. And that is how I saw it through this whole thing. You know, I would show you guys a curve every day, right? It was a curve, and we would talk about a curve, flatten the curve. It felt to me like we were climbing a mountain. And you couldn't even see the top of the mountain because the top of the mountain was like in clouds. And nobody could tell you where the top was. So it's climbing up a mountain. Every day is hard. Every day is a steep incline. 40 deaths, 50 deaths, 10,000 cases. Every day is a difficult, hellish day. Well, how high is this mountain? How high do we have to climb? Nobody knows. The mountain is as high as you make it. What does that mean? The mountain goes up until you flatten the curve. because you're designing the mountain by your actions. I mean, just think about how bizarre this was. So we climb up, 42 days, we're able to flatten the curve, we hit a plateau, and now we're coming down the other side. Well, how long is the descent? Nobody knows. It depends how New Yorkers react and how New Yorkers respond. And see, every line on that chart, that was a day. That was a day. That was a number of hospitalizations, a number of deaths, every day. And what we did today determined the number tomorrow. And we had to go through this not knowing where it ended. 400 people died today. Well, what's going to happen tomorrow? We don't know. We'll have to see. When does it stop? We don't know. We have to see. And New Yorkers climbed that mountain and they flattened that curve. The early projections from all the models, we had 18,000 people in hospitals. You know what the early models said? 120,000 people in hospitals. That's what the early models said. 120, 130, 140, 160. Well, how far can we get that down? Nobody knows. Depends on how you act. We went from 120,000 projected hospitalizations, 18,000. God bless the people of New York. I will never forget what they did. Literally saved tens of thousands of lives. Remember what we did, and we don't want to go back there. We don't want to go back there.
So would you delay potentially phase 3 in New York City? And what should the NYPD and Bill de Blasio be doing to enforce no mass gatherings, wear your mask, etc.?
Yeah, I don't want to. We have been on schedule with the entire phased reopenings. And the other regions are all ahead of New York, right, in terms of reopening. And we've done the reopenings, we followed the data, and the data is all still down, right? The infection rate is down all across the state. We're going to enter phase 3. The indoor dining piece is just one component of that, and that's something that we want to study. But we are on track for phase 3. This indoor dining piece, I do want to make sure we study, again, in light of everything else. If it was just indoor dining, we've done a lot of work on the air filtration system. With the filters can actually, I think, make a significant difference. But if it was just indoor dining, it would be one thing. But it's indoor dining, and you have the congregation problem, and you have the viral spread across the nation, which I think is really problematic for us. We are a state that is a hub. It's more of a problem for New York than probably any state in the United States. And that's why I implore the president to get into the game. First, as an American citizen, I want to protect those other citizens and give them the support they gave us. Second, for the economy, if we don't get this under control, the economy is going to get worse. And third, on a parochial level, they will come here. It is a matter of time, but they will come here. And the virus came in through our airports once before. It will come through again.
Governor, given some of the places that are seeing hotspots, a huge level of spread, a lot of them are suburban, a lot of them are rural, does it make you reevaluate at all your initial assessment that density was the main driver of New York City big outbreak?
Well, we never said anything was a main driver. It was the main driver in New York City. In retrospect, now that we have the facts, Dr. Fauci said this. CDC head said this. The main driver was the virus came from Europe. And it was the greatest miss by the federal government of all time. China virus, China virus, China virus, China travel ban. Forget the China travel ban. It was in Europe. And they literally have traced our strain of the virus back to Europe. January, February, March, 3 million people come through our airports from Europe. And then you have the density and the public transportation and everything else. But more than anything, we just didn't know. Nobody said, screen people coming from Europe. Nobody said to the people of New York, watch when you go have a meeting with people in Europe. Watch if you have guests who are coming from Europe. It was just a total miss by the federal government. That was the main point. I gave you the 7 deaths today. 8 deaths is the 3-day average, right? Let's take one more. I'm sorry, did I answer your question?
Partially.
Suburban rural tends more to come, you see that more in clusters. You see that in the Westchester cluster, you saw that in the New Rochelle cluster, you see that in Montgomery County now, you see that in Oswego, where when you have a flare-up, you can normally trace it back to a cluster, but it just shows you how dangerous one person can be. I'm sorry.
Yeah, just to piggyback off of what the other reporter asked you, I was curious if you're any more open to allowing the city to borrow funds for operating expenses now that the mayor said he wants the financial control board to model potential loans.
Yeah, the whole thing is, what is the loan? How do you pay it back? And what is fiscally responsible? You know, borrowing in and of itself is not a great thing, but it's not a bad thing. The question is, how much? How do you repay it? What do you think is going to happen with the economy? You know, there's a big question mark on how fast the New York City economy comes back. There's a big question mark on how fast the national economy comes back. With this virus spread, worse than Europe in this country, that is a serious question. How fast does the national economy come back? Then how fast does the New York City economy come back? And we have the same question all across the state. How fast does the Nassau economy come back? How fast does the Buffalo economy come back? And what do you think the revenues are going to be? And what I'm focused on, what can we do to actually stimulate the economy coming back faster? Because if you just wait for the economy to come back, it's going to be a long few months before businesses really ramp up, before people really feel comfortable going to places of density, going to a Broadway show, going to a packed restaurant, going to a packed bar, going to a convention at the Javits Center or in a big hotel ballroom. So that is a very large question mark, and you have to know that answer before you have any reasonable judgment of what you're going to be able to pay. Okay? Thank you all very much.
Well, guidelines for reading is supposed to be coming out this week. He said before it will be out by the end of the month.
Yeah, I'll check on the exact date for you. We don't want to do it again. Zach, Luis. I'm going to put this in the lobby of the New York Times. I thought it was a suitable location. Actually, I bring it with me wherever I go. It's styrofoam. I can carry it. I'll see you guys.